Now at 5:30, how are you spending this Thanksgiving? If you're planning on enjoying time with the family and friends today, you're certainly not alone, but that doesn't mean that things are completely back to normal. COVID-19 cases are on the rise, and as Britt Conway reports, hospitalizations and deaths could be too.
We're seeing an uptick of cases.
New COVID-19 cases have been on the rise for about a month, nearing an average of 100,000 a day over the past week. But does that mean this could be the start of a new wave?
You know, it is conceivable that that is going to be the case.
In part because of timing.
Cold weather, people going indoors, vaccination potency waning.
By December 17th, the CDC's latest ensemble forecast predicts thousands more will be hospitalized that day, between 4,100 up to more than 12,000. And by December 18th, it predicts the total number of deaths will hit between 794,000 and 822,000. Based on where the death toll stands now, that could mean between 20 and 48,000 more Americans will die from COVID-19 over the next 3 weeks.
But we can do something about it. We still have about 60 million people, adults in this country, who are eligible to be vaccinated, who've not gotten vaccinated.
So the vaccination push continues, along with the push for the fully vaccinated to get boosters. And one expert believes boosters could make the biggest difference.
Increasing the rate of protection for those who are already protected, but giving them that extra boost, I think that will have a shorter and quicker impact than getting the unvaccinated vaccinated.
I'm Britt Conway reporting.
A new study says that people reinfected with COVID-19 have a rare chance of being hospitalized. Researchers looked at more than 353,000 reinfected people in Qatar. They found that patients' odds of ending up in the hospital or dying were 90% lower than an initial COVID-19 infection. Only 4 cases were severe enough that they had to go to the hospital. No cases required ICU treatment.